Morning, good afternoon. I will try to share my screen. Could you see the presentation?
Yes.
Yes.
Perfect. So, good afternoon. My name is Elizabeth Pavon Vasquez. I am a third-year internal medicine resident at Maya West Medical Center in Puerto Rico. I would like to thank you for the opportunity to present and share our data and findings. Before starting talking about COVID in our hospital, I would like to share some geographic information about where we are right now. Puerto Rico is located in the Caribbean. It's the the smallest island of the Great Antilles, surrounded by the Caribbean Sea and the Atlantic Ocean. As the rest of the world, we were impacted by the COVID-19 pandemic. Interestingly, Puerto Rico has 153,934 reported cases of COVID-19 by PCR since the beginning of the pandemic until yesterday. The incidence rate in Puerto Rico is 7.92, and the positive rate of infection is 3.08. 3,269 patients has died due to COVID-19 infection since the pandemic started in Puerto Rico. Hopefully, 91% of our population had at least one dose of COVID-19 vaccines until yesterday. This is a map of Puerto Rico. The red point is where we are located, our main hospital, Maya West Medical Center. This is the place that we did our research and the recollection of the data. We did a retrospective analysis of the records of patients that were admitted with a COVID PCR positive test. The time of the research was 1 year from March 2020 to March 2021. The variables that we were considering were age, sex, municipality, symptoms, comorbidities, treatment, and outcome in our patients. We measured frequencies and we made a statistical analysis like mean analysis and average analysis. We had 176 patients admitted with a COVID PCR test from March 2020 to March 2021. Their range of age most frequent was 51 to 75 years old with a 76 patients. The mean age in our population was 63.8. We found that 90 males were more frequently admitted than females in our hospital. When we look about the municipality and location, the residence location in our patients, we found that Maya West was the most frequent, followed by Añasco and Cabo Rojo. These municipalities were the closest one to our institution, so it's expected to treat people close to our hospital. Interesting, we have 2 patients that reported living in the mainland that were here on vacation and got infected, and we treat them and admitted them in our hospital. We found also that 32% of our patients were asymptomatic at the moment of the diagnosis. In multiple occasions, we found that patients have a COVID-19 infection because we did a routine PCR for any surgical procedure, and it came back positive. 68% of our admitted patients and our population have any symptom of COVID-19. When we ask our patients if they can recall how they get infected, we found that 64 reported that they were in close contact with someone that had the infection. 19 reported that they got the symptoms after they came from a travel outside of Puerto Rico. This is very interesting because we are on an island. So most of the infection was community transmitted. When we asked what are the symptoms that they reported, we found that the most common one was shortness of breath, followed by cough, fever, and then fatigue. Other symptoms that they reported that were no more frequent, but they mentioned it, was headache and diarrhea. When we talk about comorbidities in our population, we found that hypertension was the most common comorbidity in our population, followed by diabetes mellitus. If we ask them about the smoking history, only 50% of our population reported they used to smoke or are active smoker. When we think about obesity as a factor of comorbidity, we found that only 26% of our population have a BMI more than 30, representing an obese patient. In terms of treatment, we use different medications based on what was reported on the literature and what is going on the research. For that reason, some medications were changed, or we no longer use those medications because the data says that it's not beneficial for the patient. However, the most frequent one that we continue to use during this whole year was the vitamins, minerals, and melatonin. And also the dexamethasone or steroids is pretty common that we continue to use those medications in our population. In terms of outcomes, during the year, 23% of our population with a COVID PCR positive test died. The mean length of stay in our institution was 11 days. What have we learned during this year? The most affected patients were those between 51 to 75 years old with a past medical history of hypertension and diabetes mellitus who were infected by community transmission. We also found that shortness of breath was the most common reported symptom by the infected patients. The use of vitamins, minerals, and melatonin is still under study to assess effectiveness in the definitive management. However, we found that 76% of our population survived the infection with this adjuvant therapy. In terms of our island, the government effort for mandatory use of masks, social distancing, and hand hygiene, in combination with vaccination evidence required for any indoor activity, has positively impacted the community and positively impacted our numbers and how we are surviving and managing this pandemic. As a take-home message, males older than 50 years old who are hypertensive should follow more strictly the COVID-19 precautions. In addition, as a physician, we should be aware that a non-specific symptom like shortness of breath should not be ignored in this population because it's the most common one reported in patients that are infected by the infection. This study has helped to identify demographic and clinical profile of patients, as well as to add clinical data about the infection. These are my references. Thank you for the opportunity to present and to share our findings with you. A special thanks to Ms. Vanessa Ruiz, Ms. Maria Gonzalez, Dr. Jose Rivera, Dr. Miriam Padilla, and Dr. Jessica Castillo for all their help during this year with the data. Thank you.